In other news, the Food and Drug Administration has now started the process of updating the safety label of acetaminophen products, saying they could increase the risk of autism.
It also sent a notice to all doctors, reading in part, quote, "In recent years, evidence has accumulated suggesting that the use of acetaminophen by pregnant women may be associated with an increased risk of neurological conditions such as autism and ADHD in children." It goes on to say, in the spirit of patient safety and prudent medicine, clinicians should consider minimizing the use of acetaminophen during pregnancy for routine low-grade fevers. This consideration should also be balanced with the fact that acetaminophen is the safest over-the-counter alternative in pregnancy.
Jade Jarvis spoke with a Palm Beach County obstetrician to address some of these concerns that many pregnant women may have now. Jade?
Well, Todd and Tiffany, Dr. Jeffrey Litt has 40 years of experience as an OBGYN and says that the use of Tylenol is a question that has always come up with his patients. And despite yesterday's announcement, he stands firm that Tylenol is safe for pregnant women.
And all the studies in the past 20 years that have been published that cite that Tylenol is safe in any trimester pregnancy are based on those studies, not on these testimonies.
Dr. Jeffrey Litt reacting to President Donald Trump's announcement linking Tylenol use by pregnant women to autism in children. He says the study cited by the Trump administration did not have a high enough sample size of patients studied and relied on anecdotal evidence.
You can't prove cause and effect unless you do a well-controlled randomized study with lots of patients.
Dr. Litt has been a practicing OBGYN in Jupiter for 40 years and is a fellow of the American College of Obstetricians and Gynecologists. He says even before the announcement, patients have had questions about Tylenol, dialogue that he welcomes.
I think that they need to discuss it with their physicians. A lot of the things we treat Tylenol with, it's one of the only safe drugs that we use extensively in pregnancy, and it treats problems that the problems themselves could hurt the pregnancy worse than any amount of Tylenol you can take.
Some of those medical problems include preterm labor, preeclampsia, and urinary tract infections that could affect the kidneys. Now, Dr. Litt worries this conflicting information could cause delays in treatment and hurt pregnant women and their babies.
I think they should question and they should get a reasonable explanation, but they need to know that the decisions we make in medicine are based on scientific evidence and have nothing to do with politics.
And Dr. Litt urges every pregnant woman to have an open dialogue with their doctors if they have any concerns. In studio, Jade Jarvis, WPBF 25 News.